Welcome to Doctors on Call. I'm Jenna Miller. Arthritis means inflammation or swelling of one or more joints. It describes more than 100 conditions that affect the joints, tissues around the joint, and other connective tissues. Specific symptoms vary depending on the type of arthritis, but usually include joint pain and stiffness. Treatments vary depending on the type of arthritis. The main goals of arthritis treatments are to reduce symptoms and improve quality of life. Heart disease describes a range of conditions that affect the heart. Many forms of the disease can be prevented or treated with healthy lifestyle choices. What are some steps to keep a healthy heart? We'll discuss these issues and more on Doctors on Call with our guest, family physician, Dr. Ferrill Conant.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Regional Hospital, experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Dr. Ferrill Conant is a dedicated family practitioner with more than 3 decades of experience serving the community at Smith County Family Practice. Dr. Conant attended Mid-American Nazarene University and graduated from the KU School of Pharmacy. He then attended the Kansas University School of Medicine and completed his residency at Wesley Medical Center in Wichita. Dr. Conant has been in the Smith Center medical community since 1989. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us. It's great to have you on board tonight.
Thanks for having me.
Absolutely. We're going to go ahead and start with arthritis for this evening, then we'll move on to heart health. But first of all, the most common types of arthritis are rheumatoid arthritis and osteoarthritis. Can you explain the difference between the two?
Sure. Yeah, those are both really common forms of arthritis. Osteoarthritis probably even more common, and it affects our weight-bearing joints, typically the hips, the knees. It can affect the hands. Rheumatoid arthritis they both are arthritis. Rheumatoid has a different cause, and that is, in effect, the body reacting against itself. So there's more of an inflammatory component to rheumatoid arthritis, and therefore their treatments are substantially different.
Okay, so let's talk about the differences and how you would treat somebody with each one.
Okay. All right. Well, with osteoarthritis, actually with both forms of arthritis, stiffness, pain, swelling, limited motion, those are the things that bother patients and what brings them to our attention. So then we have to start with how do we address those concerns. Joint protection can be with a variety of things. Sometimes a brace may be helpful. Usually I try to involve other ancillary services like physical therapy to reduce pain and stiffness. Certainly there are medicines that we use to treat osteoarthritis and rheumatoid arthritis. Again, different medicines because of their different underlying causes. So some of the typical treatments for osteoarthritis would include anti-inflammatory medicines, either applied topically to the joint or taken by mouth. Tylenol is still a good medicine for pain. It has benefits and advantages in some patients who may not, for various reasons, be able to take anti-inflammatory medicines. Rheumatoid arthritis, on the other hand, does require different treatments to try to arrest the progression of rheumatoid arthritis because it will damage and destroy joints if left unmanaged. So a different type of treatment regimen, we call these DMARDs, disease-modifying agents in rheumatic diseases, and those would include some of the older medicines like hydroxychloroquine, methotrexate. Some of the newer medicines, they're not new anymore, they've been around for 10 years or more, injectable medicines like Humira, and others that I'm not even familiar with. I leave that to my rheumatology colleagues.
Absolutely. Now you mentioned Tylenol. If a person hasn't been to a rheumatologist or the doctor and is maybe trying to self-medicate, is there any risks in taking Tylenol, ibuprofen for long term?
Yes. You know, Tylenol, if it's taken within the recommended dosing range, as long as there's no other condition that would interfere with our body's ability to metabolize and excrete Tylenol, it's very safe. And so I generally would allow folks to take up to 1,000 milligrams of Tylenol 3 times a day if needed. In some cases, even up to 4 times a day for a short term. So that'd be 4 grams of Tylenol a day. It's always best if you can take a break from the medicine and not take it every day. Ibuprofen, the most common over-the-counter anti-inflammatory medicine, once again, a very effective, very useful medicine, but it also has dose limits that we have to be careful of, and some additional side effects that are not associated with Tylenol, mainly effects on the gastrointestinal tract, maybe leading to an increased risk of gastrointestinal bleeding or ulcers. So I recommend ibuprofen be taken with food, and it can be taken 3 times a day. There again, I'm using a maximum dose of 800 milligrams 3 times a day. Always best to take a break from treatment if you can. For some patients, they try that and they have to take the medicine daily. In those cases, I'll often prescribe another medicine to help protect their stomach, a medicine like omeprazole or pantoprazole, and studies show that that helps reduce the risk of some of those gastrointestinal side effects.
Interesting. Now, I know sometimes they'll encourage a person to maybe take Tylenol and then a couple hours later take a dose of ibuprofen. I saw a study recently that said actually taking them together can be more effective.
They can be combined at the same time, so that's allowable. There again, if you can avoid them or minimize the dose or take them intermittently, it's always best. But they can be combined at the same time.
Sure. And what are some of the risk factors if a person maybe has a form of arthritis and it goes untreated?
Long term, the joint, whatever joint's affected, will deteriorate. All of these treatments, especially with osteoarthritis, they're designed to relieve the symptom, the pain, the stiffness. But the joint, if it's untreated and if it's unattended, it will continue to deteriorate. Speaking of the knee or the hip, oftentimes, eventually, you'll end up with sort of what we call end-stage joint disease, and that may necessitate a visit to the orthopedist to talk about joint replacement, either knee or hip. Those are the most common joint replacement surgeries.
Sure, absolutely. Now, how is arthritis first diagnosed?
Most often, based on symptoms, a patient will come in with a symptom. For rheumatoid arthritis, again, a less common form of arthritis, one of its hallmarks is stiffness of the joint or joints that are affected in the morning on arising. So morning stiffness is a hallmark. Not every patient has that, but the majority of patients do, and that may last up to an hour. In contrast, osteoarthritis, the stiffness and pain of osteoarthritis is sort of like in the evening. It's after use of the joint through the day. So their pain is worse later in the day. So symptom presentation is one way, and oftentimes we will do an x-ray of the affected joint. That may give us a clue, although an advanced form of osteoarthritis of the knee, for example, in some patients may look awful, and they say, well, my knee doesn't hurt. Or they may have horrible knee pain and their x-ray doesn't always look bad. So it's a useful test, but we have to use history and physical exam. We use physical exam because in the example of rheumatoid arthritis, it's usually small joints of the fingers and the hands that are affected, and it's usually the proximal interphalangeal joint and the MCP joint of the hand. They'll be swollen and soft and kind of boggy and tender. Osteoarthritis in the knee may show swelling. In the hand, it's usually the distal fingertip joints of osteoarthritis. So they look different, they are treated differently.
Interesting. Now, you've mentioned several times the stiffness and pain that obviously come along with the arthritis.
Yeah.
That might make a patient not want to move. But how important is it for them to keep moving?
Yeah, it is important. The joint will become stiffer and probably less mobile, less useful if a person doesn't try to maintain some level of activity. And so it is important that they try to do that. Walking is usually an exercise that we feel is less stressful on joints. Stationary bike riding. We'll often use our physical therapy and occupational therapy co-workers to help with that too, and give patients sort of a range of motion exercise that they can do that doesn't stress the joint but keeps it moving. Otherwise, it'll get stiffer.
Excellent advice. Okay, we're going to go to the phone lines. We've got a caller waiting to ask a question. This is Sarah on the line from Downs. Hi, Sarah. Go ahead with your question for Dr. Conant tonight.
Hi. I was told by a rheumatologist that my symptoms of achy joints and inflammation are related to arthritis. But when I completely cleaned up my diet, all of the symptoms went away and my test came back normal. I'm just wondering why this happened.
That's a good question. I'm not sure I know the answer. I really am not certain how a change in your diet would affect your arthritis. I'm glad it did. Doesn't work that way for everyone. Mm-hmm. So it's interesting that the rheumatologist thought you had some form of arthritis. Healthy food is always good for us, no matter what condition we're trying to what condition we're trying to treat.
Sure. So. Now that brings up a question of what would you find more important, eating well or exercising more, or is it just a combination of the two? That's great.
It's all the above.
Mm-hmm.
It is all the above. Everything that we do to our bodies and for our bodies can have a negative impact or a positive impact. So this is the body God gave us. We need to take care of it.
Absolutely.
And do all we can.
Sure. And can exercise actually ease the pain and stiffness of arthritis?
It can. It certainly can. And there again, for example, after joint replacement surgery, it's essential to have motion of the joint restored almost immediately. Otherwise, inflammation that's after surgery will cause increased stiffness, and then you may be unable to get that joint moving like you want it to, and it won't be as functional.
Sure. Let's change directions here a little bit and talk about what is gout and when should you seek medical attention.
Sure. Gout is a subtype of arthritis. It almost always affects a single joint, and the most common joint is the great toe joint. It is usually a diagnosis of you walk in the exam room and say, you have gout. And the patient's coming to us because they're in usually quite severe pain. Gout is caused by deposition of uric acid crystals in the joint. Uric acid is a chemical our body makes. We all have uric acid. If the blood level in our system is too high, it can precipitate attacks of gout. The uric acid actually crystallizes and it settles in a joint, causes excruciating inflammation. And so it's very treatable. There again, people almost never can say, I rode this out at home, because they are really miserable with it. So we have really good treatments. Early treatment is always best.
Sure. Now, if a person is diagnosed, can any of these, arthritis or gout, can it ever be reversed, the disease?
Gout is controllable by lowering the uric acid level. We have good medicines that are taken every day, allopurinol being one of the most common, that will lower blood uric acid levels. We have a goal below 6, and if we can keep the uric acid level below that, we feel like we can minimize the amount of flare-ups of gout. Late presentation, untreated gout can really be bad because it can really damage joints and be irreversible. The other arthritis, osteoarthritis, our treatments don't cure it, all right? And same with rheumatoid, but it's important with rheumatoid to have early treatment to try to arrest the disease and keep it from progressing, to save the joint.
Absolutely. Now, is arthritis, gout, are these all types of autoimmune disorders?
No, the rheumatoid disease we talked about is an example of an autoimmune disorder. In effect, the body somehow recognizes itself as foreign, as not self, and mounts an inflammatory reaction against the joints. That's characteristic of autoimmune disorders like rheumatoid. There are others, for example, ulcerative colitis, Crohn's disease. Those are autoimmune disorders. They can have associated with them arthritis, probably on the same basis. So, but other forms of arthritis, osteoarthritis, is more, we used to call it wear and tear. I still think that's a fairly descriptive and accurate term because it's the weight-bearing joints of our body, the spine, the hips, the knees that are most commonly affected. Age, advancing age, increases the chance that our joints will begin to suffer a little bit.
Sure. And are any of these preventable?
Well, probably not rheumatoid. You either have that or you don't. Mm-hmm. Osteoarthritis, Many folks who have that disease are overweight. If they can lose 5 or 10% of their body weight, it can reduce their symptoms. I've also seen plenty of patients who are rail thin and they have bad knees. But typically, obesity is a risk factor for joint wear and tear.
So there's no reason for a patient to feel as though they've done something to cause this?
No. Osteoarthritis may follow an injury. For example, an athlete, a male or female athlete who might have injured their ACL knee ligament in school, they get it repaired, they are at higher risk down the line, 10, 15, 20 years, of developing arthritis in that joint because of the injury, even though it was correctly treated and fixed.
Absolutely. And have you seen arthritis develop in juveniles?
Yes, that's rare. If I see a juvenile, a kid with arthritis, that's definitely a referral to a specialist. It does happen. I think it's pretty uncommon. I haven't seen it a lot in my years of practice.
Sure, absolutely. Well, we want to remind our viewers at home that we are going to be moving to heart health, but if you have a question still about arthritis, we'd be happy to go back and cover that as well. So let's talk about what are some of the risk factors for heart disease.
All right. You know, I see patients every day, as do all family physicians, with heart disease or risks for heart disease. So when I'm talking to a patient, they may not come in for that, but if they're just coming in for a health check, I try to have some discussion with them about, for example, family history of heart disease. That's not a modifiable risk, not modifiable. It is what it is. But in men, if a immediate family member, a parent or sibling, had a heart attack before 55 years of age, that probably increases that person's risk. For females, women, if a heart event occurs before 65, that qualifies as what we call premature coronary artery disease, giving family members an increased risk. So you have what you have genetically. The things that are common that are modifiable, smoking, that's number one. Smoking cessation. If you stop smoking, your heart disease risk can drop 50% in the first couple of years. After a while, the heart can forgive us, and our heart risk from previously smoking can go back to like we never smoked. So that's always an incentive for me to try to encourage folks to stop smoking. So smoking, diabetes is a risk factor, hypertension or high blood pressure is a risk factor, hyperlipidemia, high cholesterol is a risk factor. Those are all modifiable. Those can be changed by choices we make, and with, in many cases, with medicines that we have that are effective.
Absolutely. Now, you've mentioned smoking. We have many doctors who also encourage stop smoking.
Yes.
I'm interested in, right now, the big thing seems like it is vaping. Does it have the same effect?
Vaping is not a healthy replacement for smoking. It is not. There was a time, probably 10 years ago, when electronic cigarettes first came available. They were an inhaled form of nicotine. I had patients who struggled with smoking, with nicotine addiction, and they'd come in and say, you know, I've been using these e-cigarettes, electronic cigarettes, I'm not smoking now. I said, okay, that's good. But next, you got to get rid of that. Vaping, though, is different than the original electronic cigarettes. It was just nicotine. Vaping has a lot of other stuff now that I don't think we even know what chemicals are in it to give flavor and aroma. They're damaging, and so it's not a healthy substitute in any way.
Okay, good to know. Now, when should you seek emergency medical care if you're thinking you're having a heart issue?
Yeah. So the symptoms that may occur if you're having a heart attack, we always ask patients, are you having chest pain? That's a bad question, but we ask it all the time because people with a heart attack may actually say, well, I didn't hurt, I wasn't pain, but I had this heavy weight on my chest, like an elephant or something squeezing around my chest. So if the patient's describing their pain, their discomfort, and they're saying, it just feels like this, and they're squeezing, that's a pretty good clue. Some other symptoms could be, if that discomfort comes on with activity, usually that's worrisome. It may be associated with other symptoms like a cold sweat or difficulty breathing. Sometimes the discomfort that begins here goes through into the back or into the jaw or to the shoulder or arm. All of those are warning signs that should not be ignored. You should seek medical care.
All right, what are some symptoms of coronary artery disease?
Some of those we just talked about.
Okay.
If a coronary artery has a blockage that begins to be critically or completely blocked, you're in the throes of having a heart attack. That's what occurs with coronary artery disease, which is a narrowing of the coronary arteries brought on by atherosclerosis, this process that begins in adolescence, deposition of fat and atheroma plaque in our arteries. Some of it's genetically driven, some of it is lifestyle driven, and our diet that's rather probably a little heavy on the red meat lends itself to that. So symptoms of a heart attack would again be occurring if an artery that's narrowed occludes, and then you're having all these symptoms. You should come in immediately because that can be treated. Oftentimes, even in our rural hospitals, we have ways, if we see a heart attack in progress, we can give medicine to try to dissolve a clot that's blocking an artery while we're making arrangements to immediately transfer a patient to a higher level of care, have a cardiologist take care of them.
Okay, very interesting. We're going to go back to the phone lines. We've got
Okay.
David on the line from Garden City. Hi, David. Go ahead with your question for Dr. Conant tonight.
Hi, I've had an issue with my pain in my lower back. I've gone to numerous cortisone injections. I think I've gone through everything. I've had the lumbar acid injections and the SI injections. I was wondering what would be my next procedure if those don't seem to work. I mean, I'm not in intense pain, but it's a constant pain.
You are like many, many patients who have tried a lot of things. You've tried a lot of the things that finally lead up to finally saying if they are no longer effective and your pain is intolerable, it may be time to have a consult with a surgeon. We try to avoid surgery on a patient's back if we can. Back surgeons try to avoid surgery on a patient's back if they can. So it is felt to be a last resort because it can be done perfectly, technically well, but the outcome may not be as good as you'd like. So you may be looking at visiting with a neurosurgeon.
Absolutely. Okay, let's talk about what causes irregular heartbeats.
A number of things. The most common thing that we see is what we call palpitations. That's an awareness of your heart beating either hard or irregularly or rapidly. Many people who have palpitations, it's not of any real significance. When it causes symptoms, that's when we really want to dig into it and dive into it and find out more about it. We would then say, well, we're going to find out if this is a true arrhythmia, an abnormal rhythm of the heart. An occasional irregular beat that you might feel, most people have those on occasion. And they may be a little more common at various times, maybe under stress or too much caffeine or something like that. But if the symptom is repetitive, happening more often, making you feel bad, as if, for example, lightheaded, dizzy, weak, short of breath, or this bad feeling in your chest, well, that merits more testing. We would start with an EKG, probably a chest x-ray, additional laboratory. There's even really good ways to have patients wear a heart monitor for a period of 1 day or 3 days or a week or 2 weeks, because almost always those symptoms are not happening when the patient comes in. They tell us about them. They're not happening right then. So we can try to drill down and see if, for example, a patient has atrial fibrillation. That would be the most common irregular heartbeat that requires medication or treatment.
Absolutely. We have just a little bit of time left, but
Okay.
let's talk about what range your cholesterol should be at to keep healthy.
Now, me as a doc, I'm a cholesterol hater, and I am aggressive in treating high cholesterol. If I'm treating a patient with a medicine to lower their cholesterol, I'm looking at the goal to lower their bad cholesterol. That's the low-density lipoprotein LDL cholesterol, at least below 100 for some patients, below 80 for some patients, as low as I can get it, below 50. And that is because statin treatment, which has been around all my career, 35 years, has the longest track record of benefit. of about any medicine we can think of. I sort of jokingly tell my partners and some patients, we ought to have statins in the water supply. That's not truly the case, but they are effective medicines. So it's a part of looking at the big picture. If I'm treating it, I'm aggressive in trying to get it low.
Excellent. All right. Well, thank you so much, Dr. Conant, for coming and being our guest tonight on Doctors on Call. And our next Doctors on Call will be discussing the new weight loss medications. You can email questions to our next program, that address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.